So what are some of the risks for this, right? So look, I showed you that a list. This is another reference on this list. Look at these things, right? We talked about the obesity, obviously. Family history, retinopathy. That's where if you ever notice somebody that has a small jaw and the jaw tends to go backwards, so they can even have a little bit of an overbite. What that's doing is it's making the airway at the back of your throat smaller, and they can get sleep apnea that way, right? What are some of the symptoms? Okay. So now you're all going to look at this and say, I must have sleep apnea, right? Because look at all these things. Yeah, I do that, I do that, I do that, right? But it starts to give you an idea of what you can expect if you're taking a history or a patient is saying, look, I have this problem or that problem. Look at this list, right? When they have the irritability, the mood, right? The morning headaches, those can be sleep apnea symptoms, right? All right. How do you screen for it? Okay, so a lot of people here know about the Epworth Sleepiness Scale, right? But there's other screen tests. One's called Stop Bang, right? And what you start doing is looking at patients to see, do they seem to have any of these criteria, right? In particular, when you see that body mass index going up, that's a big indicator that that's going to be a problem. When you see the people with the big, heavy, thick necks, that's a big indicator, right? That you know that's going to be operating here, right? And when you look at somebody, when you examine them, there's also this pattern, right? So if you want to take a look at yourself, go take a look and look in the mirror and look at the opening of your mouth in the mirror. So if you have a big open airway, then the air gets through easily. But some people have that uvula hanging down, that soft palate hanging down, and it's really crowding out the tongue. You're gonna be more likely. So that's why when we talk about obstructive sleep apnea, we say it's really by two things: the anatomy of the neck and your weight. That's the vast majority of obstructive sleep apnea. The anatomy, what you're born with, what the size of your throat is, and how much weight do you have, right? Okay, rest up. So what we're going to do is I'm going to show you one of the studies that we did in the office on sleep apnea and sleep complaints, right? In the California workers' compensation population. This was published also, okay? So this is all the patients that were referred here during a 10-month period that had sleep complaints, right? Did the standard review systems, did the standard activity daily living, did the Epworth Sleepiness Scale, right? And then for the testing, right? Used a portable device. We've talked about that. We've talked about the data that says that portable devices work well. They're quick, they're cheap, people do them at home, and it gives you a quick look. Do they have sleep apnea? Do they not have sleep apnea, right? So we had 330 patients that came in during that period of time, right? 210 said they had sleep problems, right? 210 or 330 patients. This is a huge number. Of course, this is California. Everybody has to feel the experience, but that's a huge number, right? Out of those, got 206 successful studies, okay? So that's the data, right? As opposed to when you say to patients, go to sleep lab, you know, so many of these, I can't go, I can't figure it out, and it gets delayed. These are much quicker and easier to get back from the patients, right? Right. Let's take a look at this population, right? So we're in California population, 210 out of 330 said they had sleep complaints, 206 had good studies to look at, right? So what do you see? First of all, what's the prevalence of obstructive sleep apnea in this population that had sleep complaints? Almost 57%. That's huge, way above national averages, right? And patients with obstructive sleep apnea, no surprise, had higher body mass index, had greater amounts of hypertension, diabetes, dyslipidemia. Now, what these are on the side here is, I've given this talk before to doctor groups, right? So these are called p-values, and what does it mean? It's statistically significant, meaning that people with sleep apnea versus no sleep apnea, those with sleep apnea were much more likely statistically. This is not just random chance, right? That they're going to have this problem, all right? Next, let's look, okay? Look at this table, look. So you've got obstructive sleep apnea here, not obstructive sleep apnea here, okay? So how many were men? So you see there's a lot more men in the sleep apnea group. How old were they? Not a big difference. But look at that. the body mass index, how fat they were. Those stars, statistically significant differences right down the list, right? And that's what you see in the literature. That's also what we see in California in this study, right? Next, look good. Note that the patient complaints did not help you in knowing whether or not they had sleep apnea or not sleep apnea. So look. Here's sleep apnea's list. Here's non-sleep apnea list. So patients will say to you, I can't think clearly, I got headaches, I got depression, I got anxiety. Those things don't help you, right? So in other words, you have to test to know, is there something going on? In particular, is the sleep apnea there, right? Okay, next, 4 more results. Note that all these conditions correlated with obstructive sleep apnea. So in other words, what I've been saying to you is, look, if you start having reports where see people with diabetes, hypertension, right? Those things are clues that sleep apnea may be operating on that patient, right? So those are how they interact, right? The sleep apnea seems to lead those things. Those things seem to be bellwethers, markers to let you know there might be some sleep troubles underneath that. And you need to know that because you need to know how to treat these people adequately and know what's causing their conditions. All right, rest up. These are the boys when they're much younger.